has now died from the measles in the United States for the first time in 10 years. This is the first death amid a measles outbreak in West Texas, which has now risen to 124 cases across 9 counties. Hospital officials say that child was not vaccinated. There were also 9 cases in eastern New Mexico. Measles is a highly contagious virus that can survive in the air for up to 2 hours. It can also lead to dangerous complications like pneumonia, blindness, and death. So here to talk more about this with us, about this outbreak that's been happening in the southern portions of the United States, we have Dr. Omer Awan, a physician and senior public health contributor for Forbes. Dr. Awan, thank you so much for being here with us. So let's get straight to it. How concerned should Americans be about this particular outbreak?
Very concerned, Alva, because measles, as you said, is extremely contagious. I mean, everyone is at risk if they're not vaccinated. And the important thing to remember here is that there were only 285 cases of measles last year. And now, just in this outbreak alone, we have 124, and it may increase because vaccination rates have declined in childhood. And remember that in the year 2000, the World Health Organization declared measles to be eradicated in the United States. But because our vaccination rates have declined, we now see a resurgence of it. And the vast majority of people who are getting this are unvaccinated children. So really critical for parents to get their kids vaccinated against measles.
Dr. Awan, why are the vaccination rates declining?
Well, I think one thing is that there's so much misinformation about vaccines. And even if you look at social media, there's so much information about how vaccines aren't safe, that they're linked to autism, and there are no scientific studies to suggest that that's really the case. And vaccines are extremely safe. They're effective. You know, research has shown that if you get the measles vaccine, just even one dose, you're 93% protected against getting measles. And if you get both doses, you're 97% protected against measles. That essentially means you're not going to get measles if you get vaccinated. And the proof is here in the data. I mean, the vast majority of people, over 95% of people that have gotten measles in this outbreak, are unvaccinated children. So I think it's very crystal clear that they're extremely effective.
Yeah, 1 week ago, we were reporting on this. There were 58 cases in Texas, and today that's doubled. It's a little bit more than double there in that state, and not only in Texas, but in another state as well. Is the rate of growth here the norm for a virus like this?
It certainly can be, especially with measles, because it's extremely contagious. It stays in the air for 2 hours. It can infect anyone. 9 out of 10 people, if you're not vaccinated, can literally pick up the virus. So it's extremely contagious, and this is a norm. And I'm scared that we'll start to hear more hundreds of cases if vaccination rates don't improve. Herd immunity has been threatened here. And for measles, we need up to 95% herd immunity for us to control the disease. And that rate has declined in counties in Texas that are affected and in New Mexico. Usually the rate now is around 92% in some of these counties. So we really need to encourage our kids to get vaccinated.
And then if we have this herd immunity situation that is threatened, what about the people who are already vaccinated? Are they in danger?
Well, you can still get infected even if you're vaccinated. It's kind of similar to, COVID or the flu. You get the vaccine, you can still get the infection. But the important thing to remember here is that even if you were to get infected, symptoms are usually mild, very mild. You wouldn't really get the complications. You certainly wouldn't die from the disease. And the same is true here for measles because it's contagious. If there's a high amount of virus circulating in the air, even if you're vaccinated, you could potentially still get the infection, but it will be very mild, and you certainly won't get infection of the lung, as you were saying, or swelling of the brain, which are 2 complications of measles. And you certainly wouldn't die from getting measles if you're vaccinated. So really important for people to get vaccinated here.
And how is this treated?
There unfortunately is no treatment or prevention for measles unless you get vaccinated. So there's, of course, supportive therapy. You can take some medications, IV fluids, to help you, but really the best way to treat this and prevent this is vaccination. And we have to keep saying that. We have to keep repeating this. And I've repeated this multiple times for a reason, because It's that critical. It's extremely critical for us to get vaccinated because this is the treatment and this is literally the prevention for this disease.
So listen to this. Today, RFK Jr., who is the new Health and Human Services Secretary, he said this is mostly affecting the Mennonite community, a community that may have lower vaccination rates. So does this mean that the larger community shouldn't be as concerned?
Everyone should be concerned. Everyone should be concerned. And I'm happy that, RFK has said that it's related to vaccination, but he himself is a vaccine skeptic. And I'm hoping that he comes out a little stronger and promotes vaccines, because this data is highly concerning when 94 to 96% of the people that are getting measles in Texas are those that are unvaccinated. So, and there have been a handful of people that have been vaccinated that have gotten measles, but again, the symptoms are usually mild. So I'm hoping that everyone gets vaccinated, and this is concerning for everyone, not just people that have, lower vaccination rates, because again, people that are vaccinated can still get the disease. And the more cases there are, the higher likelihood there is for even people that are vaccinated to get the disease. So we have to do our part to get vaccinated, because not only are we protecting ourselves, we're protecting everyone else around us.
Yeah, and earlier today, we know that President Trump had his first cabinet meeting. RFK Jr. was in that room as well. A question about measles came up, and then he pointed out the fact that last year there were 114 outbreaks, or I'm sorry, there were 14 outbreaks compared to the 4 that we see so far this year. I mean, what do you make of that answer? Because you're telling me that last year there were 285 cases altogether. So when he's saying there were 14 outbreaks and now we have 4 so far this year, I mean, what do you make of that?
Well, I think he's downplaying what's happening here. I mean, 124, that's almost half the amount of cases that existed all year last year. This is a serious threat, and I'm scared that we will surpass 285 in a couple days or a week. And we have to be very clear with our messaging here to the general public, because the public needs to know that vaccination is critical here, and that's the only way we're going to get through this. That's literally the only way we are going to prevent these diseases, if kids continue to get vaccinated. And that's the message here. And that's what everyone needs to understand. It's literally as simple as that. And if we don't talk about it enough, we're going to start to see more and more outbreaks, not just in Texas, but even in other parts of the country where vaccination rates are declining.
And I wonder about booster shots. Is that something that people should be thinking about at this point?
Well, if you don't know your vaccination status, there's no harm in getting the vaccine. And certainly if you've been born after 1957 and you got vaccinated before 1968, you should actually get vaccinated, because chances are you got the inactivated version of the vaccine, and that wasn't as effective as the live attenuated vaccine that's now given to people. So even if you've been vaccinated in the past and you fit that criteria, you should actually get vaccinated. So boosters help. Certainly 2 doses is better than 1, but even getting just 1 dose is extremely effective. 93% protection against the measles, and that's not really that bad.
Okay, Dr. Omer Awan, thank you so much for being here with us to talk about this measles outbreak that we have seen grown by 100% in just 1 week. You're ringing the alarm about this, so thank you for breaking down all of the details for us. Thank you, sir.
My pleasure.